What is high blood pressure? High blood pressure, also known as hypertension, is a condition characterized by elevated pressure in the arteries. Blood pressure is measured in millimeters of mercury, mmHg, and is expressed as two numbers: systolic pressure over diastolic pressure. The systolic pressure represents the force exerted on the arterial walls when the heart contracts, while the diastolic pressure represents the pressure in the arteries when the heart is at rest between beats. Normal blood pressure is typically considered to be around 120/80 mmHg. However, high blood pressure is diagnosed when blood pressure consistently exceeds 130/80 mmHg. Hypertension is classified into two main categories. Number 1. Primary, essential, hypertension. This is the most common type of hypertension and has no identifiable cause. It tends to develop gradually over time, often due to a combination of genetic and lifestyle factors. Primary hypertension is influenced by factors such as age, family history, race, obesity, sedentary lifestyle, high sodium intake, and stress. Number 2. Secondary hypertension. This type of hypertension is caused by an underlying medical condition or medication. Secondary hypertension can be a result of kidney disease, hormonal disorders, such as Cushing's syndrome or hyperthyroidism, certain medications, such as oral contraceptives or nonsteroidal anti-inflammatory drugs, or conditions that affect the blood vessels. High blood pressure is often referred to as the silent killer because it typically does not cause noticeable symptoms in its early stages. However, if left uncontrolled, it can lead to serious complications over time, including an increased risk of heart disease, stroke, kidney disease, and other health problems. Managing high blood pressure involves adopting a healthy lifestyle, including regular physical activity, a balanced diet, low in sodium and high in fruits, vegetables, and whole grains, weight management, limited alcohol consumption, and stress reduction. In some cases, medication may be prescribed by a healthcare professional to help control blood pressure. Regular blood pressure monitoring and working closely with a healthcare provider are important to diagnose and manage high blood pressure effectively. What are the symptoms of high blood pressure? High blood pressure, or hypertension, is often called the silent killer because it typically does not cause noticeable symptoms in its early stages. Most people with high blood pressure are unaware of their condition until it is detected during a routine checkup or when they experience complications related to hypertension. However, in some cases, individuals with high blood pressure may experience certain symptoms or signs that can indicate elevated blood pressure levels or related complications. These symptoms can include: Number 1. Headaches. Some people with high blood pressure may experience persistent or recurrent headaches, particularly in the morning. Number 2. Shortness of breath. Difficulty breathing or shortness of breath, especially during physical activity, can be a symptom of high blood pressure or related heart problems. Number 3. Chest pain. Chest pain or discomfort, known as angina, may occur in individuals with high blood pressure and underlying heart disease. Number 4. Vision changes. Blurred vision or visual disturbances can be a sign of severe hypertension, potentially indicating damage to the blood vessels in the eyes. Number 5. Fatigue or confusion. Excessive fatigue, mental confusion, or difficulty concentrating can occur in some cases of severely high blood pressure or hypertensive crisis. Finally, it's important to note that these symptoms are not specific to high blood pressure and can also be attributed to other conditions. Additionally, many individuals with high blood pressure may not experience any symptoms at all, underscoring the importance of regular blood pressure monitoring and routine checkups. If you are concerned about your blood pressure or experiencing any of these symptoms, it is advisable to consult a healthcare professional for proper evaluation, diagnosis, and management. They can perform a blood pressure measurement and conduct further assessments to determine the underlying cause of your symptoms and provide appropriate guidance.